Hello everyone. Today I'd like to talk about autoimmune, rheumatism, and arthritis. My name is Shane McLean and I'm a registered traditional Chinese medicine acupuncturist. I have a patient who's been coming into the clinic with autoimmune arthritis. Coming into the clinic, she told me her pain scale usually listed somewhere around a 5 out of 10. If she overworked her hands, she would have a spike to about a 6, and what the experience would be for her would be burning, stinging, sharp pain. The rheumatism was in both hands and feet, but worse in her right hand. The pain was mounting up, and it was affecting her lifestyle and the things that she enjoyed doing. It was affecting her sleep, and it was affecting her stress levels. After about a month of treatments, this patient has improved greatly. Number 1, she's off her medications. Number 2, her usual 5 that she'd be sitting at for pain, she now sits around a 2, sometimes a 3 out of 10. And the spikes of pain that would sometimes last up to 2 days, sharp, burning, stinging pain, she listed as 6 out of 10. After she overworks her hands now, it only gets between about a 3 or a 4, and is always gone by the next day, back down to that 2. She's sleeping better, and she's feeling better, and she's much happier. Now, in dealing with autoimmune, there are a couple of key things that we need to focus on for treatment principles. Number 1, we need to work with the digestive system. We need to make sure that the stomach is producing stomach acid and breaking down proteins. Number 2 for the digestive system is we need to work with the small intestine, because it's through the small intestine that these proteins that don't get broken down escape, permeate through the small intestine wall, and then get into central circulation and then strike an immune response. And what happens is those proteins are very similar to the human proteins in our tissues, and so then the immune system confuses which proteins to attack and begins to attack healthy tissue. The next thing that we also want to focus on is the autonomic nervous system. We need to focus on that because that's our stress response, which is sympathetic tone, and our rest and digest response, which is our parasympathetic tone. The immune system and digestion need parasympathetic tone. It needs rest and digest. If we're in sympathetic lockup and we have stress, which pain will create, we're going to have more inflammatory cytokines being released by the immune system and attacking healthy tissues. So we need to calm and balance that system down. And as well as the last treatment principle, we need to reduce pain and we need to reduce inflammation. And how do we do that? We end up triggering the pituitary gland. The pituitary gland will do 2 things. First off, it will release beta endorphins, which are the body's endogenous opioids for pain relief, naturally. The other thing that the pituitary gland will do is release ACTH, which will go to the adrenal glands, and it will release cortisol anti-inflammatory factor to help calm down the inflammation in the body. So how do we do that with acupuncture? Let me show you. We do this treatment in 2 parts. One part, the patient is face down, and the other part, the patient is face up. So with this patient, we begin face down treatment. And the first point that we put in is right here at the base of the tailbone. The reason for that point is that there's a major parasympathetic plexus of nerves, parasympathetic being rest and digest, parasympathetic nerves all through the sacrum. So we want to trigger that. Another point we did was up at L1 of the lumbar, and that's right at the adrenal glands, and we want to stimulate them for the anti-inflammatory factor as well. We also do a point on the arm, on the outside of the arm, combined with a point on the inside of the arm. These 2 points together help regulate the autonomic nervous system, the balance between sympathetic and parasympathetic, the balance between a stress response and rest and digest. So this is calming the system down. Another couple of points that we did for this patient to calm things down is we did a small intestine point here, which also helped with the circulation and what's happening with the swollen knuckle on the pinky finger, and we combined that with a heart point, which is right here that goes with the ulnar artery. Now what we're doing with the ulnar artery is we're doing what is called a blood electrification treatment. The blood requires negative electrons, and by adding negative electrons to the blood, we are giving it its natural charge. The red blood cells, in receiving a natural charge of negative electrons, allows more oxygen in the blood cells, which gives them the ability to offload their nutrients and oxygen and then be able to pick up the carbon dioxide and the metabolic waste. It also stimulates the white blood cells and gives them a charge to be able to do their jobs to clean up pathogens and also regulate the function of the immune system, because the white blood cells are part of the immune system. The other thing that it does is that it creates blood flow and lowers blood pressure. How does it do that? Well, negative repels negative. So by adding a negative charge to the outside of the artery and giving the blood cells their natural negative charge, which they lose every time you hold a cell phone, because a cell phone is a positive charge. And what will happen with that positive charge is the blood cells will begin to clump. It's been seen with live blood analysis. And so giving it that natural negative charge, negative repels negative, the blood cells disperse, they start to flow properly, they start to be able to get into the capillaries and do their job. Another part of the treatment, once we flipped over and we're now face up, is to do a couple of important points. Here's a point here on the stomach channel, stomach 9. Now this is going to help with digestion, number 1. It's going to come down into the stomach. Number 2, and what's most important in terms of inflammatory cytokines and things like that with the immune system, is that this is where the carotid sheath comes down through the neck. The carotid sheath holds the carotid artery, so we're doing blood electrification again. It holds the jugular vein, and it gives us the ability to target the vagus nerve. Why is the vagus nerve important in autoimmune? Well, because the vagus nerve, coming down out of the brain into the ears and down into the system, comes to what is called the celiac plexus of nerves, which is kind of located in the abdomen behind the pancreas. It goes to all kinds of places. It goes to the intestines, whether large intestine, small intestine, goes to the heart, goes to the pancreas, goes to the liver, the gallbladder, and it goes to the spleen. And what it does when it reaches the spleen is that it triggers the spleen for acetylcholine. Acetylcholine is related to the immune system because it goes to the macrophages, and it's the macrophages that are releasing the inflammatory cytokines. It becomes like a switch, so you can regulate the immune system and turn off that inflammatory reaction by triggering the vagus nerve with negative electrons that come down and go into that plexus of nerves and go to all those different areas. Another point that we did is we did a point down on the foot, which we're just going to move this down a little bit, right in here, and that's a spleen pancreas point, another digestive point that comes all the way up here. It meets with the stomach point, and it helps regulate digestion again. We did a stomach point out here called stomach 40. It helps reduce phlegm and inflammation in the body as well. It helps calm the mind. We also did on the hand a point here called large intestine 4. That point is very important. It is the body thalamus point. The thalamus point is important because that's what stimulates the pituitary gland that I was telling you about. And to finish off, what we also added was the ear thalamus point. The ear thalamus point, let me just put this up here like this. Here's a model of the ear. And inside the ear, right in about here, is the thalamus point. And again, that stimulates the pituitary for the body's natural opioids for pain relief. And it stimulates the pituitary to stimulate the adrenal glands for anti-inflammatory factor. One more point I almost forgot about was small intestine 16, which is right here on the neck. Now, the SCM muscle that comes from behind the ear and attaches to the front there of the collarbone is a major parasympathetic muscle. And this is a really important point. It also helps close sphincters. Things like the lower esophageal sphincter for people with heartburn, also with the sphincter between the small intestine and large intestine. If there's a problem there, people can end up with inflammation and back pain and all kinds of things like that. So this here again, another point for parasympathetic activity. We can't stress how important parasympathetic activity is because that's what's going to regulate the nervous system. That's what's going to make healthy digestion. That's what's going to help her sleep, and that's what's going to bring stress down. And so by releasing pain, reducing inflammation, and by creating parasympathetic tone, we start to create a terrain in the body that's healthy and happy and pain-free. So what'd you think? I hope you found that helpful. I hope you found that informative. How acupuncture can help stimulate the body to help create the correct terrain in the body for health and wellness. Now, I should say at the same time, in all those points, we used electrostimulation. Why do we use electrostimulation? Well, number one, there's certain frequencies that will help key certain things in the body, like those endogenous beta endorphins, opioids of the body that help with pain relief and help with anti-inflammatory factor and help with parasympathetic tone. You can't say enough about the negative electrons of the body. The earth gives a negative electron charge. And this is important for your well-being. This is what you need. A positive charge is where cancer grows. That's acidity. That's the acidic side of the pH scale. We need to be on the negative side of the millivolt scale, which is the alkaline side of the pH scale, which promotes oxygen, digestion, parasympathetic tone, and rest and digest, okay? If you or someone you know has autoimmune, arthritis, and thinks that you could benefit from this treatment, like and follow and reach out. Thanks for watching.